हेलो ऑल ऑफ यू, वेलकम बैक टू माय चैनल। सो आज हम पढ़ेंगे फॉरेंसिक्स का एक चैप्टर विच इज़ फॉरेंसिक साइकेट्री. सो फॉर कमिटिंग क्राइम देर इज एन टू थिंग विच इज़ एन criminal intention that's called mens rea and criminal acts that called actus rea. So criminal intention is absent in insane. Insane in India are not responsible for crime that comes in 84 IPC. So basically there is a law for insanity that known to be McNaughton's law, which was implemented in 1843, and that give an IPC also, that give an rule that insane people is not responsible for any sort of crime. So basically McNaughton's law, which was implemented in 1843, in that there is a person who was suffering from paranoid schizophrenia. So there was law came through 84 IPC that unsound mind due to mental disease. Then McNaughton's law said that defect of reasoning due to mental disease. So that was having an reasoning that the person is having a mental disease, so it's not responsible for sort of a crime. Now we got in drawbacks due to this sort of rule, which was McNaughton's rule, and you have to remember that when it was implemented, what was it he was suffering from. Okay, so now we'll discuss about drawbacks of McNaughton's rule. So there was an like we can say there was a mnemonic called HIDE. So HIDE meant to be hallucination, impulse, delusion, and emotional factor. So McNaughton's rule is known as legal test, right or wrong test. Okay, so McNaughton's rule को legal test, right or wrong test भी कहा जाता है. So there are some sort of other rules also, which was like American Law Institute test, if adequate capacity to appreciate the criminality of conduct laws. There is an Bronner's rule that substantial capacity to appreciate the wrongfulness of conduct is lost. Then Curran's rule, then Durham's rule, then irresistible impulse rule test also there. Now we'll discuss about lucid interval. So phase of sanity between two period of insanity. During this period, accused will be responsible for crime, can act as witness and testify during lucid period. So lucid interval meant to be like there is a person who can be conscious, then unconscious, then conscious. So basically this is known as lucid interval. So now let's discuss about for a valid will. So that should be having a age greater than 18 years and person should be sound mind, composed mental. There is a testamentary capacity that meant to be mental capacity to make valid will that is defined under 31 IPC, and there is an holographic will also, which was meant to be like that will should be in their own handwriting, that sort of given holographic will. Okay, now there is an IPC which is 84 IPC, 85 IPC and 86 IPC. So 84 in protection of insane, 85 involuntary intoxicated which was not responsible for a crime, and then 86 IPC voluntarily intoxicated responsible for a crime, like a person who intoxicated themselves by their own responsible for their crime, but if someone give them some sort of toxic material, they are not responsible for that. Father of forensic secretary is Paolo Chescia. Now we'll discuss about phobias. So there are many different phobias, like that mean to be fear. A person having some sort of different kind of fears, like agoraphobia, fear of open spaces, claustrophobia, fear of closed spaces, acrophobia, fear of height, nyctophobia, fear of darkness, mysophobia, fear of dirt, and hydrophobia, fear of water. So this sort of fear person is having. Okay, now we'll discuss about visual hallucination and auditory hallucination. So visual is common in organic mental disorder and auditory is common in functional disorders. Now how we can diagnose insanity? Minimum there is a 3 examination. After magistrate order, person can be declared insane in 10 days and minimum time required. Okay, if and on magistrate order, insane can be detained for 30 days. Like minimumly it is 10 days, but if we ask magistrate to extend this sort of thing, then magistrate can extend it and detain it for 30 days maximum, not more than that. Okay, so there will be an 3 examination. 10 days is a minimum time required to declare by magistrate that person is insane, and then insane can be detained for 30 days if it is required. Now we'll discuss about mental health care, right? It was implemented in 1987, amended in 2017. So first was psychiatric hospital known as mental health establishment, institution or hospital. Second is 309 IPC, attempt to commit suicide has been discriminalized. Prohibition of sterilization as a treatment method. Prohibition of electroconvulsive therapy without muscle relaxant and anesthesia. And prohibition of chaining of person. So these things came in this Mental Health Care Act. And then there was an advanced directive. An individual with a known psychiatric disorder or on treatment and is not a minor can choose to decide the caretaker and the course of treatment according to recently amended Mental Health Care Act. So this was an advanced directive that individual who having some sort of psychiatric disorder and agar that is not a minor, so they can choose their caretaker by their own and also their treatment. So this was an recently amended Mental Health Care Act. Condition where person not responsible for crime is twilight state, onoroid, post-traumatic autism, somnambulism, involuntary drug intoxication, and delirium tremens. That was acute alcohol withdrawal. Like delirium tremens happen when the person used to be like withdraw their alcohol, and that side effect occurs for this delirium. And kleptomania, impulse disorder, that is steal articles, like the person steal some sort of things that known to be kleptomania. This you used to be learned. Then knowledge or insight present, does not get advantage of 84 IPC. So kleptomania people don't get any advantage of 84 IPC because this is not an people who have unsound mind or like they have a insight and knowledge present. So 82 IPC minimum age for criminal responsibility is 7 years. 83 IPC, that 7 to 12 years criminality depends on maturity age of full criminal responsibility. So that's all for my this video. I hope you like my video and please subscribe my channel, and next video will be coming soon on this channel. Thank you. Bye bye.